Prior to any assessments, the nurse would have introduced herself and verified the patient with 2 identifiers. When leaving the room, it is important to leave the bed in the lowest position with the side rails up and the call bell in reach. This was forgotten.
Hi, Sam?
Yeah.
My name's Candace. I'm a second-year student nurse with UIT. I'm with you in room 45 with patient McKelvey.
Okay.
How was your weekend?
It was good. How was yours?
Good.
Okay, so this is a year 2 student nurse. Her name is Candace, and she's going to be with me today for patient McKelvey.
Hello.
Hi. So I had a crazy night with my other patients, but I last checked on Kate at 4 a.m. She was stable with vital signs of temperature of 36.8, pulse of 62, respiratory rate of 14, blood pressure 108/58, and O2 at 96 on room air. She's receiving normal saline at 50 cc's per hour and epidural infusing ropivacaine at 0.2% at 3 cc's per hour. Narcan is at the bedside. She has a standing order for oxygen to maintain stats above 92. And oh, by the way, her sister Bahar stays every night overnight at the bed with her.
Okay, thank you.
Kate! Nurse! Kate!
So was a radical nephrectomy again?
So Miss McKelvey got her right kidney removed, and
Oh.
she's 2 days post-op.
Okay, cool. So what do you want me to be responsible for today?
Do you want to go in and do vitals, a head-to-toe assessment, and her dermatomes?
Okay.
Nurse? Hello, please help. Can somebody please help me?
Oh, what happened?
She fell out of bed.
How do you feel?
I feel okay.
Are you feeling any pain at all?
No.
Okay, we're going to help you back into bed.
Okay.
Okay, now that you're back in bed, I'm just going to do a baseline set of vitals, okay?
Okay.
Do you want me to check her lines and her catheter?
Yes, please. Okay, are you feeling any pain at all? Okay.
I guess the epidural is really working if you
Yes,
don't
it
feel
is.
any pain.
It's great. Seems to be infusing properly. Okay, just gonna go try that stuff.
And are you sure you're feeling okay? Okay. Okay, now that she's back in bed, you can go to the vitals.
Okay, do we have to do an incident report because of the fall?
Yeah, we're gonna have to, and we also have to note that her bed rail wasn't up.
Okay. Hi, how are you feeling after that fall?
Good.
Do you have any pain anywhere? Okay, great. I'm just gonna do your vitals. I'm gonna test your dermatomes because of your epidural and do your head to toe, okay?
For filming purposes, all assessments were done with clothing on, but this would not be the case in reality.
Finger. Perfect. Okay. So your respirations seem a little low. Are you having any trouble breathing? No. Just gonna start at your lower legs and let me know if you feel coldness, okay? No.
Can you go under? Because it looks like she's breathing weird.
Are you feeling this up here?
No.
No, it does look like you're breathing weird. Do you want to just press that call button and I'm just
Yeah.
going to listen to your chest?
Hi, you called me into the room?
Yeah, she's only having 8 breaths per minute. There's abnormal breathing on the left-hand side. She has no feeling rising up her chest. I'm not sure if it's the epidural or if it's from the fall.
Okay, looks like she's having paradoxical breathing. Can you go and call the doctor for me?
Yeah.
Okay.
What is paradoxical breathing?
So it's a sign of flail chest, and it might be from her fall.
what should I do? Like, is everything okay?
Just, all you can do right now is provide her comfort. Candace is going to explain more later. I'm going to focus on Kate right now. I've raised the head of the bed and I'm going to apply oxygen to help you breathe, okay?
Okay.
I'm also going to turn off your epidural because it seems like it's moving up, which can cause respiratory depression.
Okay.
I'm also going to splint your chest with this pillow to help you as well. Is there anything else I can do to help? Any comfort?
Okay.
Bahar has spoken with the doctor. He's going to order a chest x-ray to determine if it is Flail chest. If that's the case, she will have to be moved to the ICU because it's a medical emergency. Is there anyone I can call for you guys?
Just our mom, please
Your
call
mom?
right away.
Yep.
I was admitted for a radical nephrectomy, which is why I was given an epidural for pre- and post-op pain. The dermatome testing revealed that the epidural anesthesia was rising. This caused, in my case, the beginning of respiratory depression. This was assessed with a focused respiratory assessment with decreased respiratory rate and abnormal breathing characteristics. The antidote for epidural is Narcan, which Sarah said was at my bedside. When my nurse realized the epidural was causing respiratory depression, she stopped the infusion. Since the epidural was blocking pain, I did not feel the intense pain that would normally accompany a flail chest. A flail chest occurs when a segment of the rib cage breaks due to the trauma and becomes detached from the rest of the chest wall. This occurred with my fall out of bed. So the flail chest was noticed because of my paradoxical breathing. This is a medical emergency that can sometimes result in pneumothorax. The diagnostic tests associated with flail chest are a chest x-ray and arterial blood gases. An increase in PCO2 and a decrease in PO2 would have been seen. The doctor was called as mentioned, and I would have been transferred to the ICU.
In this situation, if I had known what to look out for, maybe I could have reported symptoms to the nurses sooner. With epidural, some of the health teaching that could have occurred would have been describing why dermatome testing is important so that I could report any abnormal breathing immediately. A flail chest is an extremely painful event. However, the patient's epidural was stopped because of the adverse effect that she was experiencing. So it is important to continue to reassess pain in combination with the physician, anesthetist, nurses, and the entire pain team.
Throughout this scenario, there were many opportunities to improve on nursing care. As a part of nursing praxis, it is important to reflect on the care you provide. In my part of this scenario, the most important thing to reflect on is patient safety. As Jean Watson mentions in her Caritas processes, it is essential for the nurse to take care of herself as well. At 4 a.m., I was tired and not present in the situation, causing me to make a crucial error by leaving the bed rail down. This resulted in a patient fall. To allow full presence, I will ensure to begin each shift rested, and before entering a room, I will reset my mind to focus on the patient.
In this situation, as a student nurse, not being aware of what was happening to my patient was very overwhelming. When I was updating my co-assigned nurse with the patient's status, I spoke with fear and uncertainty in front of the patient and her family. This could have scared them even further. However, I left the room to get the physician, gathered my composure, and was able to return to comfort the family with an updated plan of care.
The patient's sister rightfully was asking questions and had concerns about the patient's status, but I needed to prioritize the patient's safety and her needs. So I told the patient's sister that she would be updated once Candace returned. I understand that it is important to comfort the family, and after I provided priority interventions, I was able to assist in comforting the patient, which was seen at the end of the scenario. Thank you for watching our video.